Good day, everybody, and happy Tuesday. We're so excited to welcome Dr. Urvi Shah today to discuss the nutrition topic, which is, I think, something that all myeloma patients would like to hear more about. So the presentation for our webinar today, Food for Thought for Myeloma. So I present myself, Kettering. I'm actually taking part of all the educational material and community engagement for Myeloma Canada, more precisely for the regions of Quebec, Nova Scotia, New Brunswick, and PEI. And I introduce my colleague, Chantel. Welcome,
Hi,
Chantel.
everyone. My name is Chantal Wicks. I work with Myeloma Canada as the Regional Manager of Community Engagement and Development. I do the provinces and territories that Kettering doesn't do. So Ontario to BC, the territories in Nunavut, as well as Newfoundland and Labrador. Lovely to see you all here today. I'm glad you were able to join. I think you're going to love today's webinar.
So I will be sharing my screen. Chantal, you can see my screen? All right, so before we start with the presentation today, I just wanted to give you a bit of instructions for today's webinar. So you see my name, Karen Gravel. I have my colleague Chantal as well, and Dr. Shah. So just wanted to thank our sponsors because without them, we could not do such educational material for our community of patients. So thank you so much. How to ask questions today. So as you can see, we have our panelists that you can see on screen. Your audio or your camera is not activated as a participant. So you will be able during the course of this presentation to ask some questions to Dr. Shah, which we will address at the very end. So if you see on screen, you have a Q&A tab where you can enter your question. If you don't get to see it because you're on your phone or tablet, sometimes you just have to swipe on the side to get to the other window and see the menu bar. So where our webinar are sitting after this recording, you can access them through myeloma.ca, and you go in the resource library, go down, and you will see where we have our YouTube channel. Hit the red button. This will bring you to our YouTube page. You can directly go on YouTube and look for Myeloma Canada as well. As soon as you see our red flower, you're at the right place. You can watch all of our educational material over there, a bunch of subjects. And if you hit subscribe, you will be notified every time we load something new. Just want to mention again the services that are offered to you as a patient or caregiver. So on our website, you can have access to MC Lounge, which is pretty much the equivalent of Facebook, but a community that was developed by Myeloma Canada, private and no publicity and stuff. So really patients and caregivers where you can chat with other people. MC Assistants, our new service that we just launched last week. So it's an information service, information line, not an emergency line. So if you're looking for information or services or community services in your area, you can either call or email, and they will be happy to assist you with your request. A reminder to subscribe to our newsletter if you want to receive once a month all the updates about myeloma. All right. Let's start with Dr. Shah. Welcome again. Thank you so much for accepting to give a presentation for our community. We appreciate your involvement, and I will let you introduce yourself.
Thank you so much, Karine and Chantal, for this invitation. Are you all able to see my slides and hear me okay?
Yes, we can. Thank you.
Great. So I think it's a apt title of Food for Thought because I think this is an area of active research, but also something that as patients we want to know more about, but we don't always have those answers, and a lot to think about both as researchers and patients. And these are my disclosures. So I'll talk about how diet and cancer, there is some research around it, the trials we've done so far, how microbiome affects cancer, and then some practical tips over the next 45 minutes or so. As a disclosure, I think it's very important when I give these talks, it's generalized to everybody, but it has to be individualized for each person. So when you hear it, you have to see whether this is something that is right for you or not right at this moment. Every patient needs to be understand, are they receptive to hearing about it? Do they feel empowered or do they feel overwhelmed and this would not help? Understand whether there are medical issues related to the cancer where they're losing weight or not able to tolerate many foods, then maybe we can't really try to pick things, but eat at least something to keep the calories in. Versus if somebody has metabolic health issues such as diabetes, obesity, cardiovascular disease, cholesterol, maybe there's more of a case or understanding why these things are important. And then I think personally, some people like to make changes very immediately because they don't want to do things gradually, where then does it really make a difference? How do you see it? Versus some people like the gradual changes. So I think you have to understand what kind of a person you are or what you would prefer to do. When we think about what food or supplements should I take, I find that it's a very common question from patients and also the least likely answered question by oncologists. And so I think that there's a real need and an unmet need to have lifestyle research and also infrastructure to support patients through this, because patients want it, they feel empowered by it, it's low cost, and it can improve outcomes. That's been my focus, to study nutrition, microbiome, metabolism, and how it affects cancer and immunity. So just to bring you patient perspective, a patient messaged me once, a patient who I didn't take care of, so I didn't know this patient, but they said, my very respectable oncologist team answer, just keep eating a balanced diet. um, Simultaneously around, like within a few months of each other, on a social media thread, I had oncologists say we should not be telling our patients what to do other than just eating a healthy, well balanced diet. And maybe these recommendations of eating fruits and vegetables 2.5 servings a day is too much, and we should probably not tell patients. So these very contrasting or opposite comments got me thinking, what is a balanced diet and who follows this? And do patients know what it is? Do doctors know? And like, what do the guidelines say? And so when you look at the USDA guidelines, you can see that their recommendations is fruit 1.5 to 2 cups and vegetables 2 to 3. So it's not very high. This is the standard guidelines. And fiber intake about 25 to 30 grams. The healthy eating index is a measure of how healthy the diet is. This is just one way of measuring it, but of course there are others. And this score, an ideal score would be 100, but the US population has a score of 59. So very low on average. And you can also see that only 12% meet enough fruit intake, 10% vegetable intake, and less than 5% get enough fiber, suggesting again that the majority of people don't know what a balanced diet is, or they know what it is and they choose not to follow it, right? And so when we look at patients with cancer, and this was a study looking at cancer survivors, not just myeloma, but all in general. And what they showed was that only 12% of cancer patients ate enough fruits and vegetables. And if they had to follow all these guidelines, physical activity, weight, and alcohol too, only 4% met all of these guidelines. We also surveyed patients over 400, and majority had questions about nutrition. Majority said their oncologist didn't address it, but if their oncologist addressed it, they attempted to follow it. So patients do want to make changes often once they're diagnosed, but they really want guidance on how and what from their oncologist. And so when we looked at self-reported pre versus post-diagnosis, what we noticed is that patients after a diagnosis are intending to eat more healthy foods and reducing junk food and red meat. And they're doing this on their own, whether we give them guidance or not, suggesting that patients, once they're diagnosed, tend to make healthier choices or start thinking about diet and food much more. The World Cancer Research Fund is a great place to look for guidelines on diet. And you can see that out of the 10 guidelines, and they take basically all the thousands of studies done across all cancers and look at what are the common themes that pop up. And you can see amongst the 10, the common themes, 6 out of the 10 are around diet. One is eating a diet rich in whole grains, vegetables, fruits, and beans, and then limiting red meat, processed meat, fast foods, sugary drinks, alcohol. And only about a third of our survey respondents actually knew about these guidelines. And when they knew, at least half of them tried to follow it. We know also on this website, the American Institute of Cancer Research, they put up a lot of information on diet. And you can see they have a whole section on foods that fight cancer and foods to limit. And amongst the foods that fight cancer, you can see that they're pretty much all plant foods that have flavonoids, fiber, some of these things. And if you click on each one, they'll give you the active ingredients and why they think it fights cancer. They also have on their website saying about a third of the most common cancers, we're not just talking about myeloma, but just in general cancer, could be prevented through diet, weight, and physical activity. Of course, we're not saying that every cancer can be, even if somebody's fully healthy, they may still have a risk for cancer. We're just talking about how do we reduce our risk for future cancers or improve outcomes with the current cancer. There were 3 studies across different populations, and you can see huge numbers of populations, about 60,000, 70,000, and 40,000. And they looked at dietary patterns and risk of cancer. One was from UK, USA, and France. And you can see amongst these 3 studies, they saw very consistent findings that people who ate more plant foods had about 15 to 20% less cancer in whichever study they looked at. And this was the way it's done is they follow people for decades and they ask them to, they survey them in the beginning and say, what's your diet like? And then follow them over time and see who gets cancer. When we think about dietary patterns, and we talked about, in those studies, they've basically measured by breaking down people's diets into different groups. But when we think about mechanisms of how diet may affect cancer, we published this review article on it. And plant foods that are unprocessed have fiber, so they affect transit time. They have these flavonoids, which have anti-cancer, anti-inflammatory properties. Butyrate, which is a short-chain fatty acid made by the microbiome that can have anti-inflammatory properties too. And then fiber is very good at keeping the weight stable and improving insulin resistance and these growth factors too that could affect cancer. Many people are interested, and you hear a lot online about ketogenic diets. I will caution you for a few reasons. One is that a ketogenic diet, I think any diet can be healthy-ish if you take out refined carbohydrates. So in a ketogenic diet where the premise is to remove most or all carbohydrates, people feel better because they're taking out the refined carbs. But we are saying the same thing even in a healthy plant-based diet or any healthy diet, we want to take the refined carbs out. So weight improves, insulin, inflammation, similar things as like the fiber or a plant-based diet. What is unique is the ketone bodies. And ketone bodies basically are similar in some ways to the butyrate or short-chain fatty acids, where they have anti-cancer, anti-inflammatory properties. And the challenge is that many people who think they're doing ketogenic diets are actually doing low carbohydrate diets, and they don't get this benefit, because to get this benefit, you have to be in such a state of low carbohydrates that the body starts making ketones. And to be in that very ultra low state of low carbohydrates, it's very difficult, and very few people are able to achieve it long term. And the other risks, 2 risks with a ketogenic diet that I've seen in research, not specifically for myeloma, but one is that One study that looked at body composition suggested that the weight loss was more muscle and water than fat because they are eating a high fat diet. And another thing would be the risk of cardiovascular disease long term because when we're avoiding fiber and complex carbohydrates, we're eating more fat and protein, and those things can be associated with increasing cholesterol and things like that. So also many clinical trials looking at a ketogenic diet have been terminated because patients could not do it or they were difficult to accrue. So it's not just that one is that whether patients should do it, but even once a patient decides to do it, it's very hard for many people to continue. Whereas the plant-based diet trials, pretty much none are terminated, but you see there are very few studies looking at plant-based diets compared to ketogenic, partly because maybe this is like a novel concept. But if you looked at what I showed you, the population research, it points towards eating more plant foods. Fasting diets, it's another thing you probably have heard about. And a fasting mimicking diet or fasting diet basically works in similar ways like ketone bodies, reduction in growth factors, and helping with potentially cell death. I would again caution for this as well, especially if somebody's already losing weight or if um, somebody is on chemotherapy where they're having major side effects that are GI, because then they may not be getting enough calories, and that too can be a problem. But I think the importance of this, as you think about it for yourself, I think is thinking about eating regularly and having regular meal times. I think that is very important. And sometimes people who do this fasting actually end up regularizing their meal timings and eat within a window which can be healthier. But if you still eat like a McDonald's and fries all the time and do a fasting mimicking diet, I'm not sure that there is that much benefit if the quality of the diet hasn't improved. So this is a patient of mine I'd seen many years ago, and you can see that this patient had many medical problems. And so it was hard to treat the myeloma because we had to take in consideration all these medical problems. And so the patient could not get a transplant, could not get CAR T cells, couldn't get clinical trials, and so lived a shorter life. So I think even if we think that, nutrition, lifestyle, all these things don't make a difference for the cancer directly, very clearly they make a difference indirectly. If all the things in green can be avoided, reversed potentially with healthy lifestyle habits, and so if they're improved, we could have offered these options to the patient and the patient could have potentially lived longer. So I think that's another reason why we need to think about these things, whether the research shows that they work directly to control cancer or not. Next, I wanted to talk about the microbiome and think about what um, uh, what that means for us. So one common thing one important question is, do we have more human or bacterial cells in our body? And maybe because I'm asking, but you would see that we actually are more bacteria than human cells. So it is important to think about what the bacteria wants as well as what we want. And feeding the bacteria or the microbiome is very important, and they like fiber or fiber-rich foods. You can see that the microbiome is important in health and disease from many different ways. And the microbiome, there's a barrier called this mucus layer, and the microbiome sits inside the colon and the gut, the intestine. What the microbiome is doing is it's creating these metabolites like short chain fatty acids that go in through through the lining into the immune system and affect the immune function. When there is dysbiosis, meaning that this lining is disrupted because the microbiome end up eating some of the lining or the mucus lining I'm talking about, and they send more inflammatory signal. We tend to have chronic inflammation systemically. So the microbiome is very tightly linked to health and disease in multiple ways. And we are just scratching the surface now in terms of our understanding. When we think about microbiome diversity, that's one concept you will see a lot in studies, and I'm going to talk a bit more about it in some studies. But before we go to that, to understand what it means, think about a healthy rainforest, which has so many different plants and species of birds, animals, all of that. That is a good biodiverse rainforest. On the other hand, if you have a plantation, it's just one kind of tree of the same type. It's not biodiverse, and it's generally very it may be good to grow crops, but it's not a healthy ecosystem. So gut microbiome diversity, we want something like the rainforest, which has many bacterial species within the microbiome of the same individual. So we have seen in multiple studies, and this is from colleagues at MSK, that a high diversity is associated with better survival after transplant compared to a low diversity. And you may ask, what affects microbiome health or diversity, and is it possible to? So some of the things that researchers in healthy individuals have seen is that those who eat more variety of plant foods, more than 30 types, tend to have a more diverse and healthier microbiome. And when we talk about more than 30 types, if we have a soup with 3 types of beans and carrots and potatoes and onions, then that counts as 6 different plants, because there were 3 beans plus the carrot, potato, and onion. So what we're saying is that you want the variety, not eating the same thing every day. And I know we are creatures of habit and often like this to eat the same veggies on the side or whatever that we like each time. So go out of your comfort zone and pick up things that you would not normally do. And another thing that researchers had found in another study was that people who ate more fermented foods tended to also have a more diverse microbiome. So things like sauerkraut, pickles, kimchi, thinking about those things. The fiber gap is a concept where they were surveyed people in the US, and they asked them, do you think you're getting enough fiber in your diet? And 67% of them said, yeah, I think I'm getting enough fiber in my diet. And then when they actually looked at the diet with a survey, they found that only 5% of those patients were getting enough in their diet. So we have this optimism bias too, where we think, oh, I'm eating a healthy diet or I'm getting enough fiber. But if we actually go and measure, we may not be. And so it's important to reflect on this and think about, are you truly getting enough fiber? And is there a way for you to increase that? I'll skip this because we just talked about it in the other part. And then here's a study which showed like a high fiber diet improves microbiome health and also diversity changes for different patients. This fermented food diet also, they showed how it increased microbiome diversity and reduced inflammation. So they basically gave participants a diet rich in these foods and looked at what happens to the microbiome and immune system. Another good way to look at what happens to the immune system is when the COVID pandemic was going on. A lot of studies were done around what increases odds of COVID or reduces it. And this study looked at diet patterns and COVID severity. There were 3 such studies. I'm showing you only one in the interest of time. But these were healthcare workers in 6 countries. And they showed that basically they looked at their diet and then followed them over time and showed that the individuals who ate more plant-based diets had 73% lower odds of moderate to severe COVID, suggesting that diet, because of its effect through the microbiome on the immune system, may affect risk of infection too. So we as hematologists and oncologists have an opportunity for secondary prevention in myeloma because we already have these precancer states, and some people may end up with the cancer. As the disease progresses, there is progressive genomic or genetic changes and immune dysfunction. So can we modify this with different diets, like with diet and affecting metabolic disorders and the microbiome? So moving on to just thinking about obesity and diabetes, we know that myeloma has an increased risk related to obesity, and it's one of the 13 cancers associated with it. And we also know in another study that diabetes slightly increases the risk of myeloma too. Now, when we look specifically at dietary patterns and myeloma, there are a few studies. One was this Epic Oxford from the UK that showed a 77% lower odds of myeloma in those who were eating more plant foods. And then another study showed that those who had less inflammatory diets had a 16%, who had more inflammatory diets had a 16% increased risk of myeloma. And we showed that those who eat more plant foods have a 17% lower risk of myeloma. And then this other study where we looked at risk of MGUS, so the precancer state before myeloma, and what dietary patterns associate with it. We saw that sugary drinks, whether artificially sweetened or naturally sweetened, were associated with about a 30 to 60% increased risk of MGUS, and fruits, vegetables, whole grains, cruciferous vegetables were associated with about a similar 30 to 60% reduction in MGUS. Another concept is, can elevated body mass index or weight change the risk of progression? So if a patient has MGUS and they are at risk to develop myeloma, is there a difference in risk based on weight? And this study showed that patients who had an elevated weight were twice as likely than those with normal weight to progress to myeloma from MGUS. And this study showed the same thing in another group of patients where they showed almost a double risk of progression with an elevated weight as well. So I think we as oncologists, given we have this opportunity, is it possible that we can tilt the scale or reduce risk of myeloma with improving these factors and see what happens? So we did the Nutrivention trial, basically looking at patients with these precancer states, MGUS and smoldering myeloma, with a BMI over 25. These were 20 patients. And what we looked at is 3 months we gave them a high fiber diet, 6 months we gave a plant-based diet, and 6 months we gave them coaching and followed them for 1 year. The majority of the meals we provided, patients were eating to satiety. There was no calorie restriction. And we wanted to see, can we help them lose weight and improve diet quality too? So you can see here that diet quality improved from baseline to week 12. And even at week 24 and 52, it was much higher than where they started. At baseline, they were eating only 20% of their calories being unprocessed plant foods. It improved to 92%, and even at 1 year was about 60%. They also had sustained weight loss of about 7 to 8%, which maintained a year out. Remember, we enrolled patients only with an elevated weight. We also looked at quality of life, and we saw an improvement in overall quality of life. When we looked at difficulty following diet, we asked patients how difficult was it. Nobody said it was difficult amongst the 15 patients that responded, and most said it was easy or somewhat easy. And we also looked and asked them, did you feel personally that there was improvement in any factors? And you can see here that metabolic factors such as weight, cholesterol, diabetes, depression, anxiety as well improved for patients. And some patients also had joint pains improve and then GI symptoms too. 4 participants self-reported that they were able to stop medications like insulin, antidepressant, bupropion, potassium, and hydroxychloroquine that's used for autoimmune. So they were able to save some money too with reducing prescription medication burden. You can see that insulin resistance improved as well. Adiponectin-leptin ratio increased. which is a marker of insulin resistance. So higher ratio is a better thing, and that improved as well. Cholesterol dropped by about 20 points, and even total cholesterol and triglycerides also improved. A question that we commonly get is like, when patients lost weight, what weight did they lose? Did they lose muscle or fat or water? And so here you can see change in muscle volume compared to change in BMI. And what you can see is that those that lost more than 5% weight are towards the right of this line. And there are 3 patients here with 3 dots. And you can see that these 2 patients maintained their muscle, so they didn't lose any. And this patient actually gained muscle, but didn't lose any muscle, suggesting that even though they're eating fiber-rich plant foods, as long as they're eating enough protein and calories, they can maintain muscle mass. Another thing we looked at is gut microbiome diversity, and we showed that the intervention improved microbiome diversity. So remember, I told you higher diversity is better, and how can we improve it? We're showing here with dietary changes it was possible. We also showed that fiber directly correlated with diversity. So the more fiber intake, the more the diversity. And we showed that weight inversely correlated. So patients with normal weight had higher diversity than patients with elevated weight. We also looked at a butyrate producer. So it's a type of bacteria that makes short chain fatty acids. And those also had a trend towards an increase. Next, we decided to look at inflammation. So does the diet change the immune system? And you can see that the neutrophil count went down from baseline to week 12, suggesting less inflammation. The C-reactive protein went down by 50% in the patients that it was elevated in. And then we also looked at blood and bone marrow, so to look at immune changes. We saw that there was an improved or an increase in these anti-inflammatory monocytes called CD14, and there was a decrease in the inflammatory monocytes. So these are types of white blood cells that affect the inflammation and immune system. And you can see that these are some types of white blood cells in the bone marrow in blue. They're called the myeloid cells. These myeloid cells, if you look at these gray lines, they're mainly interacting with this CD8 exhausted cell. The gray lines are mainly all converging to the CD8 exhausted. That was at baseline before the intervention. After the intervention, it moved towards these green lines towards CD8 cytotoxic and natural killer, suggesting that there's a shift in the interaction of the immune cells from exhausted cells to more killing cells like CD8 cytotoxic, suggesting enhanced anti-tumor immunity or being at least able to affect the immune system in some ways. And so we looked at the trajectory of disease progression. Remember, most of the patients, the disease remained stable. This was because either we didn't have changes before they went on the study or because they had very low level of disease, so it was hard to see a change. 2 patients who clearly had rising disease before they went on the study, we could see that it slowed down on the study, suggesting that this may have delayed their progression from MGUS or smoldering myeloma to myeloma. We also did similar experiments in mice, and these are mice with smoldering myeloma. And then half the mice are given a standard diet and half are given a high fiber diet. What you can see is that the mice that got the standard diet, all of them progressed to myeloma at 30 weeks at the end of the experiment, versus the mice that got the high fiber diet, almost half of them never progressed to myeloma at the end of the experiment, suggesting that, again, there could be a delay in progression in the mice. This was one patient on the study, our first study, and you can see that after the study, he felt much improved, more energy, but also was able to stop insulin and overall improved his health. We are doing the Nutrivention 2 trial. Unfortunately, we don't have it open for patients in Canada at this time, but if any patient is in the US or they have insurance or are able to travel into the US, then this is a study for smoldering myeloma patients, where we are just looking at short-term interventions of 2 weeks to see what's happening to the microbiome in patients with smoldering myeloma. This is another study we're doing in New York at MSK, and also it has opened at Emory. We're looking at diet, supplements like curcumin and omega-3, and placebo supplements. So this study is also enrolling currently. Again, for a patient to take part, they need to have US-based insurance and be willing to travel to one of these locations about 5 times spread over a year. So if that's something you're interested in, please reach out to us directly and we can help coordinate and give more information to you as well. When we think about with newer therapies, is it possible that diet could improve outcomes when somebody's just getting these treatments like drugs? And is that something that we could study or look at? We don't really have data in myeloma yet, and hopefully that will change. But we know from other diseases like melanoma that so melanoma is a skin cancer, patients on the immune therapy who ate enough fiber had better survival than those who did not eat enough fiber. And they did this in mouse models and showed the same thing, is that the mice who ate enough fiber but also got the drug had the best control of the tumor. Another study was looking at high-risk acute lymphoblastic leukemia, and in this study, the patients were newly diagnosed. They were asked to restrict calories a bit and eat healthier and exercise a bit more. And then they looked to see, was there a change in adiponectin-leptin ratio. Remember, that's a marker of insulin resistance. And they showed that that improved. It got better after it. But they also showed that compared to people like not doing the study in a previous study, so historical control, it seemed like these patients on this study had better responses to the chemotherapy. Now they're doing a much larger study to confirm these findings, but it is interesting to see that they were able to show this in a small study too. And then when we think about once we finish chemotherapy, we're on maintenance, is it possible that dietary factors affect survival, time in remission, things like that? And I showed you this figure earlier that a high diversity is associated with better survival. And this is work post-transplant and done by my colleagues at MSK. We also did another study where we looked at patients with myeloma on lenalidomide maintenance. So they had got their induction chemotherapy, they got the transplant or didn't get the transplant depending on what their treatment plan was, but then they went on maintenance with lenalidomide. Then we followed them over time and we saw that the patients who were sustained MRD negative, meaning were in a complete remission 2 time points 1 year apart, they were more likely to have high diversity, high butyrate producers, and high butyrate concentration compared to those who were not sustained MRD negative, suggesting that the microbiome may be affecting long-term disease control. And we see that those that were eating healthier foods like healthier proteins, more plant proteins, seafood proteins, and flavonoids come from plant foods. So these are chemicals that are in plant foods, were associated with these better outcomes. So we think that maybe the diet affects the microbiome, affects the immune system, and improves control of the disease. We are doing a study currently where patients on maintenance therapy with lenalidomide or daratumumab, some of them are getting the diet, and we're going to follow this over time to understand its effects. So moving on just to thinking about a few things of how do we apply these things or think about it for ourselves. I think that this is not very different from what the Americans or other countries also in the Western world eat on average, but these are numbers that I got more from US-based population. So when we think about added sugar, um, if anybody feels like putting comments in the chat, we can look at those answers too. But do you know how much do people on average eat added sugar? In general, when we think about teaspoons of sugar, we're talking about how many teaspoons. 1 teaspoon is about 3.5 to 4 grams. So when you actually look at it, it's very high. It's 17 teaspoons on average. That's where 50% of the population lie. So many people have way more than 17 teaspoons. And then there are, of course, some below 17 as well. What we would like to be at ideally is less than 6 or 9 teaspoons. If we have 1 can of Coke, we're already about the 6 or 9 teaspoons in a day. A lot of the sugars people have is added sugars that or hidden sugars that we don't know. So things in like breakfast cereals or in donuts or muffins or cookies or things like that, which you don't, and sugary drinks as well. So you don't really see the sugar being added, but it's there hidden. Fiber we talked about, but most people are at basically half of what we should be. And if you just added a cup of beans every day to your diet, you'd be able to double the fiber intake. Because 1 cup of beans has about 15 grams of fiber. Similarly, for salt, too, a lot of salt doesn't come from the table salt, it's from the processed foods that we're eating. And often that's where a lot of salt comes from. When we think about fruits, most people don't even have 1 serving a day. The average is less than a serving. If you could just add 1 serving of fruit, like 1 large banana a day, you'd at least move towards at least getting 1 serving. Ideally, we should get 1.5 to 2 a day. When we think about vegetables too, the same thing, where we want to be double what we are actually getting. And then do we think we're getting enough protein or not? So protein is one thing that actually we're getting about 80 to 100 grams per day on average, but we need to just get 48 to 72 grams. So we're getting way more protein than we need to, but we're not getting enough of the other things like I talked about. And so I think it's important to just think about if you can add in, like if you add in something like beans, it will give you 15 grams of protein and 15 grams of fiber. So it's possible to get both. When you think about fiber requirements, you can see here also that a Western diet compared to a high fiber diet, if somebody's eating mainly things like eggs, bacon, chicken, beef, yogurt, cheese, none of those things have fiber. Fiber only comes in plant foods. So I put up, like here in this example, this patient had a bag of frozen broccoli, and so they got 12 grams of fiber, and then a potato, they got 3 grams. But if you that's what's adding up to the 17 grams. If you took out those things, they would have 0 fiber in their diet. Whereas a high fiber diet, if they're all plant foods, they can easily get enough or exceed the need, like exceed the 25 to 30 grams. Ideally, we want to get more than the bare minimum of 25 to 30, but at least we should try to aim for that. Now, you might say, like, if a person's eating a high fiber diet, are they getting enough protein? And so I'm just showing you what the recommended intakes for protein are. It's actually 0.8 grams per kilo is the recommended intake. If somebody feels like because they have cancer or they're older, their protein needs are higher, we can say 1 gram or 1.2 grams. So I would say 1.2 is on the higher end. And if we calculate that for a 60-kilo person, that's about 72 grams for the higher end of protein. The person on the high fiber diet is also getting 72 grams of protein, because when we eat healthy foods, those foods also have protein, and you can see that they're getting enough. The Western diet is, of course, getting way more protein, but I'm not sure that we need this much protein, and we're doing a disservice by not getting enough fiber in this situation. It's also important to look at food labels. So, if I say, okay, nuts are good, try to eat some nuts. But then if you look at these nuts, these are like honey toasted pecans, and you can see the added sugars per serving is 18 grams. Remember, I told you about 4 grams is 1 teaspoon. So this one serving has about 4.5 teaspoons of sugar just in this serving. So if you look at it that way, you can sort of get a sense of like which foods are very high in sugar and maybe you want to just avoid, especially added sugar. We want the fiber. So fiber is not a problem. It's the added sugars that we're looking at and we'd like to reduce. So another thing is eating healthy doesn't have to be boring. It just needs to be planned, right, in advance. But it doesn't just have to be salads and raw fruits and vegetables. It can be everything you like eating, just made in a healthier version. Like if you're having, like you like a stew, make it maybe with beans or tofu. Or if you like a burger, think about sometimes doing a black bean burger instead and putting more salad or veggies into it. So it's just how you make each thing. And so what I'm talking about is I'm not saying that everybody needs to be 100% vegan, because you can say you're vegan and eat Oreos and you can eat French fries, and that's not a healthy diet. But if you are eating just unprocessed plant foods on a vegan diet, that can be very healthy. So it's just how you do it. And the same thing with a vegetarian diet. Many people who are vegetarian are eating a lot of processed foods, junk food, fried foods, eggs, and dairy. So the majority of their calories are not coming from unprocessed plant foods, despite being vegetarian. So that's not a healthy diet either. What we're talking about is a high fiber plant based diet. So you're getting enough of these unprocessed plant foods. And you can do it in whichever way that works for you. But just try to get the majority. As you can see here, half the plate, and this is actually the Canadian food guide, Canadian food plate, which you can see. So what they say recommending for a healthy diet, half the plate is fruits and vegetables, a quarter is whole grains, a quarter is protein, but it's mostly plant protein, and a very small sliver of all of this is animal protein, which can be possible, but it's not the majority of the plate. And so some practical tips to consider is improving intake of whole grains, reducing processed refined carbohydrates, reducing sugary foods and drinks, improving fiber intake, the diversity of plant foods, prioritizing plant protein sources, fermented foods, unsaturated fats, like nuts and seeds, and then it's not necessary to calorie count or calorie restrict, because that's often difficult to sustain long term. If you prioritize fiber rich, healthy foods, you're going to see the benefits long term. Frozen fruits and vegetables are equally healthy, if not more. So the reason of saying, like, oh, I don't live next to a place that I can get fresh produce is not a good enough reason. If you can access frozen fruits and vegetables or cans of beans or bags of lentils, things like that, even whole grains. And if you make the changes gradually, it can be maybe more sustainable for most people. Doing everything together may feel overwhelming, and then they're suddenly like, oh, I'm hungry now, and what do I eat? And then if you feel like you're hungry all the time, you probably won't do this long enough, and then you'll go back to what you did before. So maybe picking at least one goal from all of this, like what you feel would be most impactful for you to add into your diet, and then you can slowly move on to other goals as well. And so with that, I'd just like to conclude based on what we showed you in our trial, is that the fiber-rich foods can help with weight regulation, metabolism or insulin resistance, maybe diabetes improvement, microbiome health, immune health, and then potentially in some patients, it may lead to myeloma control. That is still being studied, but there seems to be suggestion and association of this. Again, there may be some patients who may eat very healthy and exercise and may still have myeloma, or vice versa, but it's not about just one case or not. It's how we reduce our risk and we do things overall for general health. So I think it's important to change our focus from just, oh, how long am I going to live, but how well am I going to live those years and living healthier and longer. So incorporating these things, small regular changes lead to big outcomes in the long term. And so we're doing a lot of different studies, and hopefully we'll have more for you over the next years. And with that, I'd really like to thank my collaborators, mentors, patients who've taken part in these studies, funders, and it really takes a village and a team to do such science. And I appreciate you all listening.
Thank you so much, Dr. Shah. It's so incredible to have access to research studies so that we better understand, we can visualize actually. And as you mentioned, totally, it's not, I think the goal is not to become vegan, but knowing all the benefits of incorporating more vegetables and greens to our diet is very useful for our community of patients. So it's great to see all the stats. And I think microbiome is such a topic right now. So getting more information to better understand it is very useful. So I'll leave Chantal with the question period for the next 10 minutes. Hopefully we can address them all.
Yes, we have quite a number of questions. We will try to get to as many as we can, but we will let everybody know that just Dr. Shah is a busy lady, so we may not get to everything. Thank you again, Dr. Shah. What an incredible presentation. I've seen you speak before and just amazing every time. Also, what a great slide of acknowledgements. A lot of people, big slide you have there, which is fantastic. So just going to start with two questions that are actually kind of related to just defining. So if you're able to kind of give a definition of what a refined carb is and what is specifically, like what is fermented food, just so we have that clear understanding.
So when you think about carbohydrates, often people say they're all bad, and that's a big myth or a misunderstanding. There is something called complex carbohydrates, and then there's refined carbohydrates. Complex carbohydrates are things like your whole grains. So if you have quinoa, buckwheat, barley, brown rice, whole wheat, all of those things, millets, those are all complex carbohydrates. So even if you have a whole grain bread or something like that would be more on the side of complex. But refined will be things like your white flour, cookies, candy, white rice, things like that. So we want to reduce the refined carbohydrates and move towards eating more whole grains. And those whole grains have fiber, minerals, vitamins, all of those things, and they are actually associated with reduced cancer risk. So trying to get 3 servings of whole grains a day is kind of the guidelines and ideally possible. And then when you think about fermented foods, they are foods that have been sometimes cultured or fermented with live bacteria, and these bacteria kind of potentially digest that food in some ways, but also the healthy bacteria grow into it because of that. So things like sauerkraut is usually fermented, pickles, um, kimchi, yogurt, all of these things, kefir, these are all fermented foods. Even some flours, like, teff flour is sometimes fermented and then cooked. So the sourdough is a fermented bread. So there are a lot, like if you just Google what are fermented foods, you'll find many. And then you can pick natto is another one made from soy. Tempeh is fermented as well. So there are a lot of different fermented foods. Sometimes it is an acquired taste. You have to get used to it because it could be sour or, slightly bitter or things. But I think if you push past that, sometimes you will start enjoying it. I certainly, as I read the research, I make tweaks to what I eat too. And I think like I never liked, I would say, sauerkraut before or natto, but like I started enjoying it now and I do eat it more often. So it is things that it takes some time to acquire the taste for it, but then you will start realizing that you see the benefits or actually like it.
Absolutely. So we have a question, just we know that, you are what you eat and people come from various different backgrounds and have different, comorbidities or food intolerances or other things that can impact their diet. And the question is kind of, is it a one size fits all approach, and is that effective? And I think you mentioned that it is specific to the individual person, but trying to make healthier changes. But go ahead if I'm wrong in my understanding.
So I would say that there's an overall understanding of what are general guiding principles for a healthy diet, and that's kind of what I'm talking to you about in this, and also showing you that how if somebody can switch towards really pushing towards eating that high fiber kind of diet, what the benefits can be. Now there could be situations where somebody might have intolerance or not be able to eat the high fiber because of bloating or other things, but in general those are reasons why they might actually need to do it gradually and build up the tolerance. Our microbiome is something that changes on a day-to-day basis and based on what we eat. So just because at this time if you eat it you're not able to tolerate it doesn't mean that you'll never be able to, and you might want to add it slowly in or do that gradually. And I think that there is a little bit of where somebody may say like, I'm just too allergic to something, or I really hate something and I'm never going to eat it. And in those situations you have to decide for yourself, is it something you're going to try to acquire as a new taste, or it's something that you're not going to, or things. Some people like some foods better. Like you don't have to eat every different kind of fruit and every kind of vegetable, right? Like you may say you hate mushrooms, but there are so many other fruits and vegetables that you can eat, and somebody else may love mushrooms and eat more of that compared to another. So I think that it can be personalized, and it should be, but I think there are overall guiding principles that research shows consistently time and again are associated with better health. And if you can try to incorporate some of those things, then I think that's good.
Wonderful. We had a question about someone seeing mention of hyper and hypothyroidism. And are there studies on how myeloma can impact the thyroid? And this person said that they've heard a lot from others that they've had partial thyroid or a full thyroidectomy. So just curious if you know anything about this. You may not, Dr. Shah, but just
So thyroid is a hormone disorder in the sense of that, like this thyroid is over functioning or under functioning. There's only one nutrient association with thyroid, is that sometimes people who have iodine deficiency, like living in areas that don't have enough iodine in the soil, they might have hypothyroidism because the thyroid's not getting enough iodine to make the thyroid hormone. And so in general, the way the world has tried to avoid this is that more iodized salt is widely available, and that's where you don't have to worry then is there enough iodine in the salt of like soil of where I live or where the fruits and vegetables are coming from. I generally recommend it's best to have iodized salt in that way, because then you're ensuring that you're getting enough iodine for healthy thyroid hormone production. But if your thyroid hormones are checked and they're either very high or very low, then you need to talk to an endocrinologist and get treated. Thyroid hormones being low or high can be associated with weight issues, where if you have the thyroid making too much of the hormone, you can have low weight, and if you have not enough of the thyroid hormone, you can have weight gain. So definitely if you feel like your weight is going one direction or the other, or you're feeling more sluggish, it's worth getting it checked.
So we have a question. Is insulin supplementation helpful or harmful while taking chemo?
I think they wrote inulin. I think you
It's
want.
inulin.
Oh, sorry.
Yeah.
That was my fault. I misread. They wrote
No
inulin.
worries. So inulin is a type of fiber, and in general, I would say fiber is overall has these benefits, but there are many types of fiber. And inulin is considered one of the good fiber, or the like healthier fiber. But I think that what foods give us is the diversity of fibers. Like when you eat a certain fruit or vegetable, you're getting multiple fibers at the same time. When you have a supplement, a fiber supplement, you're typically getting one kind of fiber, inulin or cellulose or psyllium husk or things. So each one has a different. And I think there is a benefit to the variety of fibers because they feed different bacteria. That being said, if you need the inulin for like bowel health or it's helping you in some ways, I think it's okay to do that. But I wouldn't say that that's the best way to get your fiber dietary fiber. It's important to get it through the diet.
So we have someone asking a question that they drink diet tonic every day to help with their leg cramps, but this means there's soda in their diet. So what would you recommend in this
So
instance?
if the diet tonic's really helping with the leg cramps and you know clearly that that's what it is, you want to, like, maybe it's okay. You could maybe think about having less than a whole can or something like that. I know that tonic water also has quite a bit of sugar because to get over that bitter quinine taste, like they put quite a bit of sugar in it. So you could think about just lowering the amount that you drink if possible. If you find it's really, like, we have to again look at risk benefits. So if the benefit for the cramps is so good, maybe the few teaspoons of sugar in it is not an issue if the rest of your diet really doesn't have much sugar anyways. So I think looking at it from that perspective. Another thing is, like, what is causing the cramps? Sometimes it can be things like magnesium low or something. So maybe try a magnesium supplement and see if that's helping your cramps. A lot of people are deficient in magnesium because they're deficient in fiber. Like, to get enough magnesium, you have to eat enough fiber-rich foods. So plant foods have more magnesium. So I think, like, that could be another cause of cramps, and you could try that too.
We had a question. It was if dairy was included in a vegetarian diet in the outcomes, and I believe you did show that on the slide. But more specifically, some people have heard that reading that dairy is not good for myeloma.
So there isn't a clear study that says dairy is good or bad for myeloma specifically, but there is studies in, like, hormone dependent cancers like breast cancer, prostate cancer, that maybe dairy is more linked to those kind of cancers. And that makes sense from the point of, like, dairy is made to help baby cows grow, so it's filled with hormones for the cow to grow soon. And so we are getting exogenous hormones through dairy, so there is that association. But specifically for myeloma, there has not been a study that I'm aware. But when you look at those studies that I showed you, it is looking more at dietary patterns. So when if they're talking about vegan or vegetarian, then vegan is without dairy, vegetarian is with the dairy. So I think it just depends. If you do have dairy, I would say a fermented dairy product is healthier than a non-fermented, because it then has the anti-inflammatory part because of the fermentation. But otherwise, dairy can be inflammatory for some, especially if you're lactose intolerant. But in general, too, dairy is considered to be inflammatory and have, like, growth factors and growth hormones that can be interact. But specifically for myeloma, it's not like, I don't have that data.
Okay. We had a couple questions about your advice on supplements. So just thinking about microbiome health, are there any supplements, whether it's vitamins or minerals, that you would suggest that people take, or in other cases absolutely avoid? And we had someone ask specifically actually about turmeric BCM 95. So I feel like they're kind of similar questions. So put them together for you, Dr. Shah.
So I would say that vitamin D has been associated with low vitamin D has been associated with worse outcomes in myeloma in many different studies. Now the question is, if somebody takes the vitamin D, does that improve outcomes? Like, it's hard to study that. And in other cancers, those studies where supplementation has been done has not been shown to improve outcomes. But I think that given these studies, and we don't have a study that shows that in myeloma supplementation makes a difference or not, I think it's helpful to supplement because people can feel like they have more energy and things like that too when their vitamin D levels are good, plus the bone health component as well. So vitamin D is one I definitely recommend trying to keep the levels over 30 if possible, or at least over 20. Another one would be looking at if you are iron deficient or B12 deficient or folate deficient. So that would be if somebody has anemia and it's not clear, or they have low blood count. It's important to check those. And if you have any of those deficiencies, then you want to supplement. So those, I would say, would be the main ones. But beyond that, curcumin, some people do take because there was one study looking at smoldering in Australia that maybe showed some effect. We are studying this currently in our Nutrivention 3 study, and hopefully in a few years, I'll have some more clear answers on what is curcumin doing for the immune system, the microbiome, and myeloma. The issue with taking curcumin while you are on chemotherapy is that there can be drug interactions and rare situations where it could affect liver function too. So if you are taking chemotherapy, I would discuss it with your doctor first before you take curcumin. But even after discussing, it would be important to watch your liver function closely every few months or so, especially so that if there's any elevation in liver function, you're not taking it. So that would be something. And it's not clear whether there is going to be a definite benefit. I would say it's better to take it during maintenance or before, but not during the active chemotherapy period. And
Okay.
yeah, I think those are the main ones.
We have a question. Oh, go ahead.
Hold on, Chantal. I would just like to comment before we move on to the next. So about supplements, I'm sure taking the real food is the best thing, but we do understand that with all the treatments for myeloma, sometimes because of nausea and other issues or side effects, it's hard to have the food intake all the time. So that's why we're thinking about supplements. But just to be aware, make sure, as Dr. Shah said, to ask your doctor or nurse before you take any supplements, because some might have interactions with your current treatment. So don't hesitate to ask the question, even though you feel, oh, it's not the end of the world, it's vitamins, it's whatever it is. Ask the question. Just wanted to comment.
We have some more specific food-related questions. So someone asking about, processed plant-based proteins like a veggie hot dog. I think maybe the answer lies in the first P word, processed. And the other question kind of related is also just giving a comment on sugar. So for example, is it better to use natural sweeteners like honey or maple syrup or even stevia as opposed to sugar?
Sure. So when we think about processed plant meats, two things come to mind: is that what are what are you eating it instead of, and what are you eating it with? And that really comes to mind with every food we eat in some ways, because it's a lot of what. So if you are a person who eats hamburgers all the time, and then you are switching it over to eating a processed plant meat, maybe that's a bit better for some factors, especially like if you have high cholesterol or cardiovascular disease. But if you were only eating black bean burgers and now you start eating those, then maybe it's a little worse. So I think that we ideally would like to eat unprocessed plant foods, but if you find that to help you transition, or it's something that, because you're used to those tastes and you really like it, I think it's okay sometimes to be adding it in. There is a study, actually, it's called the swap meat study. You can look it up. It was done from Stanford. And this study asked people for, I can't remember the number of weeks, I think 10 or 12 weeks or something, eat real meat of all the, like chicken, beef, and all of those things, and then eat beyond meat, like basically the plant-based versions of that exact meat, and then looked at cholesterol, inflammation, A1C before and after, and showed that actually those who ate the plant meats had lower cholesterol, lower A1C, and less inflammation. And I think that that is because even though they are plant meats, they have fiber, because even though they're like processed, they have to have some fiber because it's from a plant source, and plants always have fiber. Processed plants will have less fiber than a real like unprocessed plant, but it'll still have some fiber, whereas pure meat will have zero fiber. So that fiber's effect is what you're seeing on the cholesterol, the inflammation, and all of that. So but yes, some of the processed meats have a lot of other ingredients and things, and maybe in the long term, we don't know what those effects are. So I would say a few times a week, short term, definitely not an issue, especially if it's helping you transition. But I wouldn't say that that should be an all the time thing.
So we had a question about intermittent fasting, so 12 to 14-hour fasting, if that's a good idea for patients with myeloma. So for example, not eating from 7 p.m. in the evening until 7 a.m. in the morning.
Again, I would say that comes down to a little bit of like what works for you. I would not do it at the detriment of like, okay, I'm so hungry and I'm like eating less calories and losing weight when you don't want to lose weight. Or so it has to be based a bit on the goals of what you want. But in general, I think it is important to eat like our clock. So in terms of our circadian rhythm, it is important to eat during the daylight or during the waking hours and not snack and eat late at night and overnight and things like that, and have regular meal timing. So if you can do that with this window that you set, then that is great. And I think if you can try to eat within a window that's such that your gut can rest the rest of the time, it is a good thing. But while you're on treatment, if that's going to make it harder because you're eating smaller portions and you need to eat more often, then I think it's not as important. So if it's possible without stress, I think it's good to do. But if it's not possible, I think at this point it's okay. The data is not clear or strong enough to say that everybody should do it.
Now, Dr. Shah, I'm looking at the time. There's still more questions, but we understand that you have things to do. So if you are not okay to take more questions, we are happy to conclude here. But if not, we could do a couple more questions.
Sure, we could do two more and then I think we can.
Okay, so we had questions about some treatments and how for myeloma patients they could cause diarrhea. And that's definitely something that we know that patients will deal with. So is taking daily probiotics, are they helpful in maintaining the microbiome in these cases? And then just another question just about, are there any specific diet considerations that people should think about if they're preparing for a stem cell?
Yeah, so those are two good questions to end on, I think. So one would be about probiotics. The data is not clear for two reasons, and I would go by how you feel your gut health is. So first, it's most important to try to improve diet quality. If with improving diet quality, you still have issues around diarrhea or just cramping or like other gut health issues, and you do start a probiotic and you find like, oh, it feels much better and I'm having more regular bowel movements and all of that, then maybe that probiotic is working for you and that's fine. But if you don't really see a difference, I wouldn't just take a probiotic for the sake of taking it. For the reason is that we don't really fully, every probiotic is different and many have different strains. If you do take one, it's better to have one with multiple different strains than just one strain of probiotic, because we want to keep the diversity of the microbiome. And it is possible that taking a probiotic reduces diversity because we're taking a few and not the whole variety. But they are the usually probiotic strains are the beneficial bacteria, the ones with good qualities and properties, and so potentially it can help for some patients. So if you have gut issues and you find that taking the probiotic makes you feel better, then go ahead. But if you don't have gut issues or you don't really have a need to take a probiotic, I would not take one. In melanoma, skin cancer, they had looked at patients who took probiotic on the immune checkpoint therapy. We don't really use immune checkpoint therapy in myeloma, but in melanoma they do. They saw that people who took probiotics actually didn't do as well as people who didn't take probiotics. And that was, I think, because of the diversity, right? Like the probiotic might be reducing the diversity. So the answer basically lies as if you think it helps your gut health, then maybe it is helping and you need to do it. And if you're having more regular bowel movements, but if that's not happening and you're just doing it because you think it's healthy, I would avoid it. Probiotic foods are probably better because they again have the variety, they come with the fiber and all of those things. And then there's a question from asking about during transplant. And so I think
and preparing as well, preparing
yes.
for stem cell.
So preparing for transplant, I would say, is like maybe thinking about what are the foods you like to eat, maybe having some of them ready, or like thinking about higher calorie foods that you enjoy. Maybe it's a smoothie or it's a shake or it's certain foods that you like, thinking about ways you're going to have access to them, or you prep them in advance and put them in the freezer. So when you're back home from the transplant, you have things ready to go if you don't have help to help you cook and things like that. In terms of fermented foods, and before that, there's a Neutro Diet study, which I missed showing you the slides for. But the Neutro Diet study is looking at is restricting the diet to neutropenic foods compared to a general healthy diet associated with less infections in people undergoing a transplant. And what they showed is that the infection risk was no different as long as you are, even if you're eating fresh fruits and vegetables, you're just washing them well and making sure. So I'm not saying eat from a place that has like food lying out for many hours like a buffet or things like that. I'm saying like if you're making a salad at home and you're washing everything well, then that would be fine. Even fresh fruit and vegetables, the same thing. Like they found that there was no difference in infection in those who had a more restricted diet compared to those who had a more unrestricted diet, and quality of life was better in those whose diet was not restricted, and weight was also better managed in those whose diet was not restricted. So fresh fruits and vegetables are okay while you're going through transplant. Based on this, you just want to make sure you're doing the adequate general safety things that you would do more clearly while you're on transplant. And then fermented foods, I think that we would not recommend taking a probiotic supplement during a transplant period, because that clearly can have very high doses of bacteria, and that could potentially lead to an infection or a risk. But when we're talking about foods like yogurt or sauerkraut, that is thought to be okay because that is again coming at lower doses and it's coming as part of the food. So foods are okay, but supplements we would avoid, especially when you are neutropenic. Probiotic supplement.
Wonderful. Thank you so much for your extra time, Dr. Shah. I think we have to conclude now. If I can just add one more tip to all this presentation on nutrition. If you want, if you're curious or you want ideas and you don't know what to eat because you're nauseous or anything with your treatment, know that on myeloma.ca in the Living Well section, you have access to 13 recipes, which were built by a nutritionist as well. So you can have a bit of idea there of what to eat when you don't know. So we're very happy to have you on board with us, Dr. Shah. This was a lot of information. We're happy that it was recorded and that people will have access to view it once more and better understand the microbiome, the nutrition, what they can eat, what they cannot. So again, know that each individual is different. So just have a talk with your healthcare team and nutritionist. Is the best thing to do. So thank you, Chantal, also for your help with the question period. And we're very happy to join you for another webinar in the future on another topic. Thank you, Dr.
Thank you
Shah.
very much, Dr. Shah. Thank you to all of you who attended. Have a wonderful day.
Thank you all. Great to be with you. Bye.